So we're going to be giving an overview of the mental health continuum. And so the mental health continuum is essentially a visual representation or a model of the range of mental health. And it shows the range from being healthy to being mentally ill and the kind of care and treatment needed for each stage in the range. This continuum is important to break down all previously known stereotypes about mental illnesses that may lead to people diagnosing themselves without a professional's opinion, which can be really dangerous. We hope it'll be a rather short but very interesting and eye-opening talk about the various aspects of mental health and illnesses.
Okay, so we wanted to start off with the definition of mental health, and the World Health Organization defines it as a state of well being in which the individual realizes their own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to their community. This definition is referring to a healthy mental state. Mental health can also be referred to as a dynamic state of internal equilibrium. So, there are three main parts of mental health: emotional well being, psychological well being, and social well being. So, in emotional well being, it refers to our emotional state, how we are managing our emotions, and it's just generally related to the emotions we feel, like happiness and satisfaction with our life and things like that. Psychological well being is more related towards self esteem and self acceptance. So, how much, like how we accept ourselves, satisfaction with ourselves, having good relationships with ourselves and others. And lastly, social well being is our interactions. So, how you feel part of a community, if you feel like you have something to contribute to society and having positive effects on society. Mental health affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood.
Another point is that mental health is not a binary state. A common misconception is that you can either be mentally ill or mentally healthy. And that's not true because there's a lot of ground within it. So there's a lot of ground between those two polar opposites, and it's also very important to recognize which side we are leaning towards. So you have to know that you can be a mix of them. You don't have to be completely healthy or completely ill. You can be a mix of both. And we'll explain this further ahead when we're talking about the continuum. So this can help us figure out where exactly we fall on the continuum. And so the continuum essentially tries to categorize mental states into stages. And our continuum has 4 stages. And of course, there are many more states within each stage, but we're just trying to compress it to make it easier. And yeah, so all of those states generally they fall on the same general area in the continuum, which we'll be talking about ahead.
So, in continuation from the previous point, the realization of mental health not being a binary state is what led us to create this model or this continuum. So, there are two polar ends on this continuum, which is mentally ill and mentally healthy. But as Sarah mentioned, there is a lot of ground in between them. And you will see in the next slide that there is a double sided arrow at the bottom of the continuum, which basically signifies that you can shift from different stages in the continuum either way. It's not a certain direction that you go in, you can move in any direction. And different factors at different points in your life can cause this shift or change. You are never stuck in one place. So, the concept of a mental health continuum is the same idea all over the world and with different organizations, but the diagrams may vary. What I mean by this is the terminology or the words used to explain this concept may be different according to different sources, but essentially they all mean the same.
And lastly, mental health is stigmatized. Basically, there's a lot of stigma surrounding mental health, especially in society. So, mental health by itself is something that's considered taboo, and people don't talk about it as much in society. And people that struggle with their mental health are looked down upon by society. And basically what the continuum does is kind of help reduce the stigma, because it shows that everybody is on the same continuum, and everybody fits in on the same thing. And as Gia said, there's a double-sided arrow. That means that people can move around, and that shows that everyone is vulnerable to going towards the ill side or the healthy side. So mental health is stigmatized, but the continuum also helps reduce the stigma.
Adding on to the point about the stigma, it also sort of makes mental health a more universal concept by placing everybody on the continuum. So it basically just breaks down the fact that all of us do have, like, we obviously all have mental health, and where we stand on it is similar to everyone else. Whether you're mentally ill or healthy, you're all on the same continuum. So this is the version of the mental health continuum that we have chosen to show you guys today. It is inspired by the NZDF model. As mentioned earlier, there are two polar opposite ends, which is mentally healthy and mentally ill, and there are four stages in total. And there are two methods of support and care. So for the healthy and reacting stages, it's self-care and social support. And when you move into the injured and ill stages, you need to get professional care. What we suggest in the next few slides are things that are recommended that you do. They're not fixed, or we cannot tell you that they will definitely work, but these are what is recommended, and it's very important that you figure out what works for you and just try out different methods and see how it goes.
So, like I mentioned before, each stage has sub stages within. So, what I meant by that is, for example, let's take the healthy stage. The healthy stage has a lot of factors within it, and you might place towards the reacting side, but still in the healthy stage. So, there are many mental states within it, but essentially you fall within the same category. And it's okay to find yourself in more than one stage. So once we show the symptoms of each stage, you might find yourself falling in more than one stage, but it's important to recognize which one you fall more into. So that's the one you ideally should identify yourself with, especially when we talk about what you can be doing for to maintain and take care of your mental health at each stage. So it's important to identify yourself. And like I said, as we keep talking, it would be beneficial for you to identify where you fall on the continuum. And also, not only now but always, because we're always going through changes. So your place on the mental health continuum will constantly be changing. So it's better to always be aware of where you are and what kind of support and help you need, if you need any. So the first stage is the healthy stage, which is otherwise known as normal functioning, and this is under the self-care and support range. So in this state, this is essentially the best mental state to be in. You have normal mood fluctuations, so you don't have too many mood swings, or your mood swings aren't as bad. All of your stress and work essentially is managed well, so there's lower levels of procrastination. You have very low levels of stress and anxiety. You might not have no level of anxiety, but it's better, because even if you have lower levels rather than zero, you might still fall in the healthy stage. There's your social situations go as per usual, so you might be socially active. Your self-confidence is the same, and you feel comfortable with others. So essentially what you do in this stage is maintain this. So you can maintain this by continuing your social interactions. So try to stay as socially active as you are now. Continue talking to people. Continue managing your work well. Like, try your best to manage your work well, manage your stress, and just try your best to keep yourself in this stage, because it is the best state to be in. But also note that small slip ups and falling into the next reacting stage is inevitable, and it's okay if you do. But what's important at that point is to fight back to go into the healthy stage, because if you don't try to go back into the healthy stage, you might fall into further stages, which is not good for you, and it's not ideal. So it's okay if you fall, but you have to try your best to come back.
So the next stage under self-care and social support is reacting, which is known as common and reversible disease. So as the name suggests, it is easily reversible. So if you're in the reacting stage, you can easily move back into the healthy stage with the right amount of self-care and social support. So it's actually very important to identify yourself in this stage because this stage will define which stage you move to next. So please, if you're in this stage, do identify yourself and try to switch back. So in this stage, you have higher levels of anxiety. There is a significant decrease in productivity, and there's also a lot more of negative emotions that you would be feeling compared to the healthy stage. So you might be more irritable or more sad or more nervous. There would be a slight change in your social interactions, meaning that it's not that you would completely stop altogether, but you might feel yourself not willing to interact socially as much anymore. And so that could be one factor to look out for. You may have trouble sleeping and lowered energy. So what you can do in this state is focus on self-care, as in take care of yourself, like rest, look at your needs, and just work on it. It's all right to take some time off, and you can use self-management skills to plan your tasks. Like for example, if you're finding it difficult to study, you can use the Pomodoro technique where it's 25 minutes of studying and then you take a 5-minute break. So you study in sets of 25 minutes and 5-minute breaks. You should increase your social interaction, do things that you enjoy, and identify problems and try to come up with the solutions. Like, for example, if you procrastinate a lot, it would be like it helps a lot when you identify the reason why you're procrastinating, because that will help you stop the procrastination altogether.
And in this stage, it's just best to find what works for you. So, like the Pomodoro technique might work with a few people and it might not, and it's completely okay. So, this at this stage, just try many different techniques and see what works best with you, because the same thing might not work for everyone. The next stage is the injured stage, and this is when we start getting into the professional care stage. The injured stage is otherwise known as significant functional impairment. So at this stage, it's not the worst mental state to be in, but it's still bad. It's worse than the first two. And at this stage, you're constantly troubled. You have persistent negative emotions, which include anger, anxiety, lingering sadness. And like we mentioned before, one of the components of mental health is psychological well-being, which is basically how you see yourself. So and one part of that is self-acceptance and self-worth. So at this point usually you feel hopelessness and worthlessness. So it's important to kind of try to fight back from this. And these emotions also, you'll notice that they affect other areas of life, such as academics and work. And for example, in academics, you might notice your grades slipping up because of this. So that just shows how important it is at this point to focus on your mental health, because it's going to affect many other areas. Um, and also at this point, people usually feel unwillingness to socialize, and because of that, their social activity decreases, and they start alienating themselves, and like there's a lot of isolation, but not as much. And there's also demotivation. So at this point, what you can do is, again, self-care is very very important. So taking time off, resting, focusing on yourself and your needs. And like it says on the slide, significantly disturbed sleep is one of them. So getting enough sleep, getting enough rest. Maintaining your social contact. So try to talk more, try to be more socially active. At this point, you might not want to, but also like notice that, I mean, like note that it's important to do that. And yeah, so try to talk about your emotions, especially with someone you're comfortable to talking with. And think about reaching out to a mental health professional, because at this point it is recommended, and it's better if you reach out and get help and move to the previous stages, rather than falling into the ill stage, which is much harder to come back from.
So the last stage is ill or clinical disorder and severe functional impairment. So this is possibly the worst mental state you could be in. There are almost no positive emotions felt. There's constant tiredness and anxiety. you start to feel disconnected from reality, and you tend to isolate yourself, so you don't socialize with people. You just like you isolate yourself, and you also are unable to concentrate, which is mainly from the high levels of emotions that, like, the negative emotions that you're feeling. So you start feeling overwhelmed, and you're not able to concentrate on anything else, and this could lead to suicidal thoughts, intents, and behavior. And at this stage, it is very important, if you identify with any of the factors here, you must reach out for help. It is extremely important. I know a lot of us feel like even if we're here, we can manage by doing self care and, just like take time off and do it ourselves. But trust me, it is much better to reach out to someone and follow their care recommendations rather than just doing it yourself. Another thing you can do in this stage is learn about the emotions you are feeling and how to cope with them. Because when you learn about what exactly you're going through, you also understand that you shouldn't equate yourself to the emotions you're feeling or the mental disorder you have, and that the mental disorder can be overcome. Like, you can overcome your mental disorder and you can move back into the healthy stage.
So now we're going to talk about the effect of the continuum on stigma. And like I mentioned initially, mental health is stigmatized, and the continuum definitely helps reduce it. So for this, to illustrate this, we're going to be using the help of a study performed in 2016, and it was published by the European Psychiatry. And in this study, there were more than 1,000 participants, and they were given a story of a made-up character named Anne who has schizophrenia.
So schizophrenia is a mental disorder in which the individual affected by it perceives reality in a very disorganized fashion. So it often comes with a combination of hallucinations and delusions and extremely disordered thinking.
People that are affected with schizophrenia are usually looked down upon a lot by society, and especially when people have these serious mental disorders, they are looked down upon a lot, and people don't associate themselves with them. But in this study, when they were given the story of the made up character who has schizophrenia, they noticed that the participants were able to find common ground with her. They noticed that the participants were able to find common traits. And one participant even said, we're all a little like Anne at some time or another. And the aim of this experiment was to kind of this study was to show to find out what effect the continuum has on stigma, and if it does at all.
So basically, after learning about the continuum, the participants were able to drop their stigma around it and actually understand that even though someone may be diagnosed with a mental disorder, they actually can go through emotions that a normal person may have gone, like, not normal, but a person who is in health, who is in the healthy stage, has gone through as well. As we explained earlier, you can shift around the continuum, which again tells us that we are vulnerable to reaching the ill stage as well, and therefore this continuum just generally decreases the stigma around it, as it puts it's like a reality check saying that everyone can be vulnerable to certain, like, to mental disorders, and it's very easy for you to just fall into the ill stage.
Okay. So, like I said, like I kept mentioning, we encourage you to identify yourself on the continuum at any point in your life, to kind of understand what support and what care you require, if you require any. One of the questions I just see. Okay, we got a question saying, how would you identify which stage you are at? So we will be posting a recording of this session later on, and if you would like, you can we can share this presentation with you. Just reach out to us through our socials. And also, so on each slide, we gave a few symptoms that you might face when you are at each stage. So it's beneficial if you go through those and kind of see which stage you are at. And like I said, you might be a mix of both. So like for example, you might notice that you have a few symptoms of healthy and a few symptoms of reacting, but it's important to kind of find that middle ground. And you might be a perfect mix of both. So look at the care we have recommended for each of them, and and kind of use a mix of each of them to kind of um, see what's right for you. Also, like I said, it benefits you to be aware of where you are on the thing at all, on the continuum at all times, and notice when you change. So and you don't have to always know where you are, but when a big change happens, you most probably will change your mental state. So it's important to notice that change and change the way you are taking care of yourself and taking care of your mental health.
It might be beneficial for you to revisit the continuum, like maybe once a month or something, and just like review the symptoms or the factors we've put underneath. And if you find yourself sort of leaning towards one that you weren't part of in the previous month, then you would understand that you need to do the certain self-care or the practices that we have listed below, and you will try to shift and move back into the safer stage.
Okay, we got another question. It says, are there different mental health care specialists to treat specific mental illnesses, just like specialists for different physical health illnesses? Yes, it's better to first get yourself diagnosed, because so if you get a basic checkup from a psychologist, they are the best people to tell you what to do further. We are not in that place. So it's best to reach out to a psychologist if you feel like you require professional care, and then they will tell you what to do further on. Yes, there are different type of doctors for different illnesses, and that is best explained by doctors themselves. Um, so thank you for tuning in to this session. Our socials are on the screen right now, so you can keep up, and we will have more webinars like this in the future. Our next session is a discussion about the stigma of mental health, which we kind of spoke about in this session. So if you found that interesting, just stay on for a bit, and that is going to start at 4:30. So in 7 minutes. Thank you.
I'd just like to add on to the question that we just got and Sarah had just spoken about. So yeah, there are different specialists to take care of different mental illnesses. So firstly, you would probably want to go to a psychiatrist to get diagnosed, since they take care of the diagnosis. Since with mental illnesses, when you get diagnosed, it's not only just the symptoms, because mental illnesses are usually a result of different hormones, like the balance of your hormones going a little off. So you would require maybe to get a blood test for certain illnesses. So that would be handled by a psychiatrist. And then they would send you to a psychologist, and different psychologists specialize with different types of mental illnesses. Okay, so we had another question. What is the role of friends and family in helping someone going through this? What is interference and what is concern? So as as a friend of someone who you think may be suffering from a mental illness, it is important that you just let them know that you are there and you will support them. But you have to also make sure that you don't like replace a mental health professional. Like they can come to you to talk about it, but you should not be replacing the mental health professional that they should be going to. And at any time you should never force them to talk about anything that they're going through, or force them to reach out for help, because that could get messy. And like reaching out for help or getting better has to come from the person themselves.
This was also spoken about a bit more by a professional in our previous talk, and all the recordings of the sessions will be up on YouTube soon, which will be found on our website. So stay tuned for that. That's it for this talk. Thank you so much. And our next talk will be starting in 5 minutes, and it's a discussion about the stigma of mental health.